نكمل محاضرة الانفلاميشن. Histopathology of a granuloma. Caseating granuloma. Caseating granuloma. Stain in caseating granuloma. Examples of granulomatous inflammation: bacterial, Mycobacterium tuberculosis, Mycobacterium leprae, Treponema pallidum, Bartonella hensel. الباراسيتيك schistosomiasis. الفنجل Histoplasma capsulatum, balsomycosis, Cryptococcus neoformans, coccidiosis, emetis, inorganic metals, silicosis, beryllosius, foreign body, suture, other prostheses, keratin, unknown sarcoidosis. Morphologic appearance of chronic inflammation, ulceration, ulcer local, defect or loss of continuity in surface epithelia, chronic abscess cavity, induration and fibrosis, thickening of the wall of the hollow viscous, caseous necrosis. Ulcer. Acute phase reaction, systemic effect of inflammation mediated by interleukin 1, interleukin 6, TNF, which interact with the vascular receptor in the thermoregulatory center of the hypothalamus via local PGE production, prostaglandin E production. Systemic manifestations include fever, catabolism, increased slow wave sleep, decreased appetite, hypotension and other hemodynamic changes, synthesis of acute phase protein by liver, fibrinogen, serum amyloid A protein, leukocytosis, neutrophilia, lymphocytosis, eosinophilia, leukopenia, increased ESR. Susceptibility to infection, defect innate immunity, delayed repair, delayed clearance of debris and necrotic tissue, lack of stimuli for repair. Allergic reaction, autoimmune disorder, atherosclerosis, ischemic heart disease. Tissue repair. The two processes of repair: regeneration, replacement of damaged cell by similar parenchymal cells. Liver regeneration requires intact connective tissue scaffold. Fibrosis, replacement by connective tissue. ECM framework is damaged. Healing is a combination of regenerative and fibrotic process. Regeneration and healing. Injury, healing, regeneration. Renewing tissue, epidermis, GI tract, epithelium, hematopoietic system. Stable tissue, compensatory growth of liver and kidney. Wound healing, wound healing, scar formation. Chronic inflammation, fibrosis, تليف. عندنا الستيبل تشو بالليفر إذا رفع جزء من عنده يعاد تكوين المتبقي، compensatory growth of liver and kidney، النمو التعويضي للكبد والكلية. Regulation of cell populations, stem cells, baseline cell population, proliferation, differentiation, وcell death, apoptosis. The stem cell divided, the most promising research in healthcare, perhaps in the history of the world, morally unacceptable, the U.S. Conference of Bishops. Stem cells, self-renewal capacity, asymmetric replication, capacity to develop into multiple lineages, extensive proliferation potential, embryonic stem cells, pluripotent cells that can give rise to all tissues of the body, adult stem cells, restricted differentiation capacity, lineage specific. Examples of adult stem cells: hair follicle, bulge, epidermal stem cells, hair follicle, bulge, بالskin, الintestine, goblet cell, absorptive enterocyte, enteroendocrine cell, crypt cell stem cells, وpaneth cells. liver stem cells, cornea stem cells, examples of adult stem cells: bone marrow, hematopoietic stem cells، نخاع العظم، خلايا الجذعية اللي تكون كريات الدم، تكون خلايا الدم. liver, hearing canal، skeletal muscle، satellite cells. الintestine, base of cryptus، skin، hair follicle bulge. granulation tissue، النسيج الحبيبي. wound healing، fibrin clot formation، filling the gap, induction of acute inflammatory response by an initial injury. neutrophil, first 24 hours, monocyte by 3 days, by third day. parenchymal cell regeneration, migration and proliferation of parenchymal and connective tissue cells and granulation tissues, synthesis of extracellular membrane proteins, remodeling of parenchymal elements to restore tissue function, remodeling of connective tissue to achieve wound strength. healing by first intention, focal disruption of basement membrane and loss of only few epithelial cells, surgical incision. healing first intention, 24 hours, neutrophil clot, 3 to 7 days, mitosis, granulation tissue, macrophage, fibroblast, new capillary, fibrous union, weeks. healing by second intention, larger injury, abscess, infarction, result in much larger scar and then contraction. healing by second intention. wound contraction. Phases of wound healing: inflammation, granulation, wound contraction, collagen accumulation, remodeling. Wound strength. Sutured wounds have 70% of the strength of unwounded skin. After suture are removed at 1 week, wound strength is only 10% of unwounded skin. By 3 to 4 months, wound strength is about 80% of unwounded skin. Factor affecting healing: systemic local, nutritional, systemic disease, corticosteroid treatment, age, immune state. Local: infection, poor blood supply, type of tissue, presence of foreign body material, ionizing radiation, mechanical factors, excessive movement, hematoma, apposition.